Compared to my normal videos, this one is going to be a little less formal and a little bit more on the raw side. I think you'll find a ton of value out of it, but because it is a different style of video, if you like it, let me know in the comments below, and I'll be glad to make more raw videos. Now, what I want to discuss today is something that I find I'm frequently having conversations with patients of mine. And it's always about like what is a good exercise and what is a bad one. And I always tell them that there is no bad exercise. To me, what I live by is that your execution needs to align with your intent. Now, the problem is a lot of us go and choose exercises that doesn't have intent. And so it's hard to know if it's actually a good exercise. But if you have intent and you are executing an exercise in a specific way that aligns with that, then I think any exercise is good. The form may look different, but if it aligns with it, great. An example we can give is from a lunge perspective. If we think of a normal lunge, the goal is to go straight up and down. And if the intent is I want to go through normal lunge mechanics and I want to make sure I decrease injury risk, then that's great. If we want to bias the glutes, we have a slight horizontal motion. If we want to bias the quads, we have more anterior translation with that verticality component. And so if you're trying to bias, if your intent is to bias the glute and you have a horizontal motion, then I say great, it's perfect. But if your intent is to have a normal lunge to decrease injury risk, to get the proper mechanics, and you're going through that horizontal trajectory, that's when the execution of a horizontal lunge doesn't align with the intent. Does that make sense? So I find that patients are always asking that question, what is good, what is bad? Now, that always then trickles into the underlying tone and message, meaning what should I do when I'm in the gym? What's a good exercise? Because I have these fitness goals, but I'm also trying to work on these rehab goals, and I don't really know what to do. And so a great way that you can start to integrate aligning with your intent is always thinking about the setup, breathing patterns, compression, and expansion. Now, I just had a conversation 3 or 4 days ago, and the patient of mine wants to continue working out from a fitness perspective, but he's also looking to improve his mobility, improve the ability of the rib cage to move, get out of low back pain. And so he asked me, can I still do pull-ups? My question directly back to him is, what is the intent of the pull-up? If someone's doing the intent of the pull-up from a fitness side, great. That's perfectly fine. It is probably going to delay some sort of results that we're working on the rehab side, but the intent aligns with the execution. But I told him if the intent is to maximize the mobility, get the rib cage moving, get out of low back pain, all the things we're doing from a rehab side, then a pull-up isn't the best option. But that doesn't mean you can't work back exercises. I think that's where a lot of patients go. Because we say we shouldn't do one thing, aka a back exercise, then people start to think that they can't do any back exercise or they can't do anything in the gym. And so what I told him is that if you get really intentional on your setup and how you're thinking of things, all you need to do is shift that pull-up to a half kneeling unilateral vertical row. Now let's break down what that means. This patient has low back pain and stiffness. So automatically switching him from a bilateral exercise to a unilateral exercise is going to allow him to rotate and move more. Once we have any sort of two-arm position, it's always going to increase compression. That increased compression is going to decrease movement. And so that's going to make that person or this guy stiffer. So switching from a bilateral to a unilateral is going to allow one side to compress while the other side is rotating, expanding. So that's always going to allow more motion compared to bilateral. So that's an easy check of the box. Next, A normal pull down to a half kneeling pull down. What's going on here? Now we're getting at the hips. We're starting to address the low back. We're getting the hips to rotate more. So being specific with the setup is really, really crucial. Half kneeling compared to bilateral. Great. And finally, we want to work on breathing strategies. When we're in that normal pull down position, compressed, he's probably going to hold his breath. In the half kneeling example, we can really maximize, start to link up your movement with your breathing. Exhale as you come down, inhale as you go up. Really take time to feel that expand on the way up. Feel it compress. So getting really specific and switching a bilateral to unilateral, a standing to half kneeling, and then really getting intentional with breathing is such an easy way that this person can still work out hard, still achieve their fitness goals, but it's still pushing them towards the right way compared to A, going through and having the wrong intent and doing our pull-ups, still wanting to get the rehab stuff, but B, it's also letting them do what they want to do. They're going to sweat. They're going to stay in the gym. We all know how important movement is. So movement from that side of things is going to help. But having that strong workout routine is key to long-term success. And so I think it's really valuable. And I hope you find that valuable the next time that you are with a patient and they ask you, what can I do? I would first ask them, what is the intent? And then they can tell you they either do or do not have intent. And then ask them, does the intent align with how you want to execute that motion? Or does the intent align with that exercise you want to do? If it does, great. If it doesn't, let's look at setup. Can we go to a half kneel? Can we go to quadruped? Any sort of positional change? Can we switch to a bilateral to a unilateral if we're looking to increase mobility? If it's someone like a gymnast and we want to increase stiffness and compression, maybe we want to go bilateral, right? So it's always dependent on the circumstance, and that's why you really have to know the intent. So like I said, I hope you found that valuable. If you like this more raw, almost case study-like scenarios, let me know in the comments below. I think a lot of us are asked these questions throughout our days and maybe don't know how to answer. And so if that's something that you are frequently met with, use that, try it out, and let me know how it goes.